Rectus diastasis. I had Jill Chill in the office this week, and she commented about how her lower back pain is gone after she had her tummy tuck. And there's always a little bit of placebo when you get a surgery like that. I do think there's some truth to that. There's some studies that have suggested that rectus diastasis repair, meaning bringing your muscles back together after they've been widened through either weight gain or pregnancy, has been shown to kind of increase your core strength. And when you increase your core strength, it decreases a lot of back pain. It helps support your body. She's able to do planks better. She doesn't have this herniation of abdominal contents through the front of her abdomen. What are those benefits of a tummy tuck that people I don't think they really realize? Because you see all the extra skin we take off with the tummy tuck, we make the belly button look better, we do the lipo, but then we're also typically repairing those muscles on the inside. That has a lot of functional and aesthetic improvements. If you do have rectus diastasis, maybe look into getting a tummy tuck to get it fixed. You can also do it without the tummy tuck, although we're already there, might as well. It's typically permanent. I have people, talk about the core strength, like Jill. If you do have a weak core and you have rectus diastasis, you may want to consult with your doctor or plastic surgeon to see if you can get it fixed.